comes.
Maybe no one comes.
We're live.
We're live.
Hey.
Hey, happy Sunday, everyone. We have not done a live Sunday Q&A before. I think this is our...
Also, there are 0 people, so we don't have to talk to them yet.
Well, this is getting recorded.
Right.
Yeah, so everyone gets to watch this. So we just...
good point. It'll get put up after. Sorry, we're YouTube live amateurs.
Yes. Also, we got to make sure we don't bump the table because then our camera wiggles.
Gotcha. Yeah. Okay.
Clearly, so we've been doing YouTube for 2.5 years almost, and we still have many things to learn. Yes. We're happy you guys like and enjoy our content. We really work hard to bring you guys quality content for sure.
We do.
I guess we can give you guys a couple of quick updates about where we've been the last couple of months, and just as we get started, and we've got a couple of questions we can get into too. Hi, Amy H. So we've actually had a lot happen in our life the last 6 months. We've moved states. Mm-hmm. Sarah took her subspecialty boards in infertility, reproductive endocrinology back in July.
Yep, found out last week that I passed.
She did very well. She's brilliant, if anyone didn't know that. And then I actually took my subspecialty pediatric cardiology boards just last week. So we're both board certified in our general subspecialties of
OB/GYN
and pediatrics.
Yes.
But we're also subspecializing for each of us. So
yes.
So, which is nice that we have that little extra niche knowledge that hopefully we can share with you guys, that you guys can appreciate that too.
Yeah.
So
we have been. Kurt should be all done with all of his board exams, assuming he passes, knock on wood. Yeah. And I will have 1 left after, gosh, how many years have we been doing this nonsense now?
Yeah, we graduated med school back in 2015, so we've been doctors now for 7 years plus. Yeah. We each did our residencies out at Yale in New Haven, Connecticut. Mm-hmm. Came back to the Midwest for a fellowship and are still in the Midwest now. So
yeah, so yeah, it's been fun. It's we obviously love what we do and love getting to share that with all of you.
Absolutely. I don't have it up. Someone commented on our post. They had asked for like key things about colic. They're really struggling with colic. We had a lot of questions recently about poop and baby stuff too. Honestly, in terms of colic, I wish I had a magic answer for you in terms of what things are going to make your baby be better or do better with that. It is something that all babies go through to some degree. It usually peaks 6 to 10 weeks of age, and then almost all of them get over it right after they turn 2 months of age. So definitely things to do are just making sure your baby is stooling well, that they're staying well hydrated. Sometimes it can be a change of formula might help, but often not. Sometimes if you're breastfeeding, it could be certain things in the diet. But regardless, it is kind of a normal part of early infancy, just as their guts are getting used to changes in just processing food. And so I wish I had a good answer for that. I would definitely reach out to your pediatrician directly too, in terms of, hey, we're really struggling. They'll know some of the other medical health issues too. As long as your baby's able to eat, passing stools regularly, as long as they're like soft. Again, stooling's really variable, but
yeah. Let's see. Charlotte May says, I'm currently trying for a baby with my partner, and I've been chain watching all your videos. So thank you. Learned so much. All your YouTube. Oh, you're so sweet, cute, amazing. So wishing you luck on the trying to conceive journey. It is such a oh, do I keep hitting the table? It's such a roller coaster, in terms of you can do everything right and it still doesn't work. We definitely have some videos on trying to get pregnant fast and helping with that. But something I kind of talk to my patients about every day is when you think about fertility in general, humans aren't really that good at reproduction at baseline. So your peak fertility is kind of, early 20s. And so if you and your partner have 0 infertility problems, okay, so this means you have regular periods, you are ovulating every month, you can detect that ovulation, you are having sex around the right time, so you're able to have intercourse, your partner has good sperm, so everything is perfect, your chances of getting pregnant in a month are really only 20 to 25%. So I would say Mother Nature's not that good at it. A 1 in 5 or a 1 in 4 chance isn't that good. So it does take time, even when you're doing everything right. In a year, we expect about 90% of couples to be pregnant. At the 6-month mark, usually around 70 75% of couples are pregnant at that 6-month mark. So hang in there. Know that A plus B does not always equal C. I know it can really take the fun out of it. But otherwise, pro tips for that are check out our video. There are many more details. Figure out timing, be tracking your cycle to.
Yeah, there's pretty good evidence that tracking your cycle and to time intercourse to ovulation and peak fertility window increases your chances of success.
The highest chances of getting pregnant are 1 day or 2 days before ovulation. And so knowing your kind of cycle tracking can be very helpful.
Okay. Amy H says, what are some strategies you are all planning to help transition toddler to being a big sibling? I wish we had some good answers for this too. I think things that we're working on are being kind, being gentle with our hands, and then even just letting her know that her baby is coming on the way. So like,
we haven't like researched this much yet. I'm sure there's like child development and different things that help, you know what I mean? Where some expert says, here's how you should help with the transition. Other moms have told me like, call it their baby and get them a baby doll and let them help you with everything. I was sitting next to a mom at a conference a couple weeks ago who had just had her second baby, and she said something that has really helped them are picture books. Like they will take pictures of the baby and the daughter and say like, Isabel loves her baby sister. Isabel hugs her baby sister. Isabel helps change baby sister's diaper. And just these different positive, simple stories of how they interact and how you want to shape that. And it's actually something I feel like I remember in the Taking Care of Babies like sleep book. She talked about having a book about a sleep routine, like baby takes a bath, then baby reads a book, then baby listens to music, then baby falls asleep, to just help you kind of like shape this story for your child. This mom said that had been very helpful, where they had some like hitting or different behavior things, that these different books had helped. We're constantly trying to talk about, you're going to have a baby brother. I think she has no idea what's coming.
Yeah. We'll find out. We'll keep.
We'll circle back to that as we do some research about that.
Okay. Teresa H says, how much should a 1-month-old newborn eat each time a newborn is eating 5 ounces every 2 hours? And I notice spit up and acid and increased fussiness. Is it because I'm overfeeding her? That is a big volume.
Yeah, I would say maybe. Breast or bottle feeding, I guess.
Formula, she said later, I think I saw her newborn is almost 10 pounds and strictly formula feeding and vanilla gentle ease. I would say generally at that stage, like it's really nice to say most babies by the time they're getting, I don't know, a month old, they're eating probably between 20 and 24 ounces in a day. And so if they're taking 5 ounces every 2 hours, like that's just a lot of formula now.
And this is such an important thing for caregivers of babies. Just because they're fussy doesn't mean that they're hungry. Yeah. And so, there are try other soothing things. Is something to
about. But also like if you're like, you can always offer the bottle, and like they probably eating like a nice range for that would probably be about 4 ounces every 2 to 3 hours is like a good rule of thumb. But also like you want your baby to be gaining weight, and so if they aren't gaining weight and you're still feeding them that much, then it's a question of, are they having trouble absorbing the nutrients, or are they burning through too much? And I would just touch base with your pediatrician to see what else is going through there. We did talk all about kind of normal volumes for babies based on age in one of our Feeding Your Baby episodes earlier this year. That maybe you can go back and check out, and that can help you.
Gotcha. Brooke Casey says, I'm pregnant with baby number 4. Congratulations. And have never been successful at breastfeeding. Any suggestions to try this time? So breastfeeding's super hard. It's kind of touted as this natural thing that women have been doing for thousands of years and whatever, but it's so hard. And so in terms of what to try this time around, I would start, as you are now, thinking about it. There are different lactation classes you can take, just to give you a different idea of expectations, and then finding yourself a lactation consultant that you like and can have a good therapeutic relationship with, to just like have a consult before you have a baby. So she can, or he can help you make sure you're set up for success.
To give you some context about like just our own struggles, I feel like, like being in pediatrics and OBGYN, we've both been around women who've been breastfeeding, working on this a lot. And even still, like we went and saw lactation in the hospital. We saw lactation the week after, then we're still having
and then
troubles.
I saw a chiropractor and somebody else and all this stuff, and she had a tongue tie and all. Like, it's hard. There are so many variables, and just misinformation about like what is normal in those early postpartum days. And it really is important that you get started right away with breastfeeding right after baby's born, in terms of like baby on the boob kind of as much as they want. There's this whole feed the baby every 2 to 3 hours thing, but babies really don't often adhere to that. When I look at my logs of how much cease was, because I was a neurotic new mom, tracking every time we ate or had a diaper or whatever. I mean, I feel like in those first couple of days, she was on the boob 16 or 20 times a day. And my milk wasn't in, and I thought my nipples were going to fall off. And it was like overall kind of a horrible time. But with some persistence and some counseling from people who are better at this than I was, we made it through. But know that it's normal to have had a really hard time with the first 3. It may take a village to get you there. And every once in a while, it isn't possible. There are a couple different diagnoses. One is insufficient glandular tissue, like maybe you just physically cannot. That is a diagnosis of exclusion and is very rare. But my advice is start assembling your village now to help you do that, if that goal is really important to you, because it's hard.
Lots of work.
Really hard.
If that's something you want to do, keep working at it.
Yeah.
And good luck.
Yes.
Let's see. Carmen Lou says, my 10-week-old baby has been fussy all morning for the past 2 days, and then he calms down in the afternoon. Because of the fussiness, he's been eating less than normal, but still makes 6+ wet diapers. Something that this makes me think about, like something new, like this is not a chronic thing in just the last couple of days, is it definitely is a season where lots of viral illnesses are going around, whether it ends up being an upper respiratory tract infection or a gut bug, something like that may be throwing things off. I think if you have a baby that's fussy, a couple of things to think about. If it's brand new, kind of they were perfectly fine and it's new, it could be that they have a little illness that they're working on. I think you're doing a great job of making sure they're well hydrated. They're still making lots of wet diapers a day. Other things that start to show up would be teething. It's a little early for that. It was actually funny when Sarah one time asked, like, hey, when do we expect teeth? And my answer was like, oh, the first teeth come somewhere between 4 and 12 months.
Which, as a doctor, I was like, do you really tell patients that kind of window? And he said yes. That's actually true.
And then I looked it up right after, and sure enough, the first tooth, it's very variable for us. I think Cece's first tooth came at 6 months. Sometimes they can come earlier. Some babies are born with neonatal teeth. So that's one of those things like, hey, is your baby fussy because they're teething? Again, probably a little early there. But I think the things are, if your baby's fussy, think about, is there any things that have changed that could be leading to changes in your diet if you're breastfeeding, or like they could just be getting an illness, and see if it's persisting for more than a week. Talk to your pediatrician too, and hopefully that helps.
Yeah, because we don't feel great every day, and babies are the same. So you just love them. But it's harder when they're fussy.
Yeah.
So, what?
How about this one? This is nice for you.
Oh, okay. I was going to do. How about this one?
Yeah,
what is ideal endometrial thickness before embryo transfer? Great question. And this is highly variable depending on you, of course, but generally we're looking for an 8 millimeter lining. Ideally, we want it 8 millimeters or above. Kind of the minimum is 6 millimeters. But what's even more important than that is the way the lining looks. The endometrial pattern is something that we're looking for called trilaminar. So you can kind of see 3 layers in it when we do this ultrasound. And so we are looking, we're hoping for 8, at least 6. And then is that lining trilaminar? We don't want to see kind of a uniform, homogeneous lining, any cystic regions, things like that. And so kind of ideal is 8. Depends on you. Plus the pattern is the most important things. And that's kind of what studies show. We do that measurement before you start progesterone shots. So this is after you've taken your estrogen, because we know that when you start progesterone, that lining compacts, which is what we want it to do. There have been studies on, how much compaction is good in terms of pregnancy rates, but we know it compacts and we know that's a good thing. So we check that lining before you start that progesterone, and that's kind of our number we use. Often I'll have patients, like when we're doing the ultrasound for transfer, say, "Oh, how thick is my lining?" And the answer is, it doesn't matter. We don't look today. What mattered was where it was before we started your progesterone. So this means a transfer is coming up, sending you all the baby dust, and hope you have a beautiful trilaminar lining at your ultrasound.
Yep. Okay. And a bunch of people have great questions. We're going to try to get through as many of these as possible.
Yeah, this is so fun.
Starving Developer says, what is the best piece of advice for a new worrying parent? I think the best advice I could give you is that you are not alone. I think anxiety about parenting and are you doing the best thing for your child? Is this normal? Is so common. Pediatrician.
I'm married to a pediatrician, and do you know how often we say, should we wake her up from her nap? Should she not? Is this normal?
Yes.
What should we what should we feed her for lunch? We're both doctors, and we are asking these questions all of the time.
Yep.
And I think the other thing that's a wonderful piece of advice is no one has it figured out.
Yeah.
Okay. So much of this is figuring out your style, figuring out your baby, because they are really unique little human beings. I remember when Cease was born, my mom was like, "Oh, she has this cute little personality."
Mm-hmm.
And I was like, she has a personality. I, as a first-time mom, just didn't even identify a personality. I was just like, it's just this needy, crying, little unreasonable human. And now I see it. Now I see her personality. But the first one, you're just like, I don't know. I remember one time we were somewhere. She was crying. She was a couple weeks old. She was crying. Somebody brought her back to me. "Oh, I'm like, I don't know what to do with her either." I don't know. So worry is normal. Know that there is a threshold where worry is too much, if it's impacting your life or your ability to enjoy your baby or your ability to get out of the house. That is a different level that may need support from a therapist or medications or different things. There's kind of a normal threshold of, I think we're all going to worry about our kids forever and ever.
Mm-hmm.
But there is also a pathologic, it's affecting your life. You can't parent. You're just so worried about all the little things, where I would say, talk to your doctor. And I definitely had moments of that postpartum where I was like, what if I'm walking up the steps and I drop her? What if I'm drinking and I drop my big water bottle on her? And I look back now and realize that was a little crazy. I remember one time the dog jumped on the bed when she was a couple days old and I was breastfeeding, and I lost it because I was just like, what if she'd landed on the baby? What if this? What if that? So you just got to keep an eye on that.
Mm-hmm.
Is this I'm worried about my kids because that's what we do as parents, or do I need to talk to somebody about this? Keep an eye on that. But I remember I asked my dad when I was, I don't know, was she born or pregnant? I said, when does it get easier? When do you stop worrying? And he's like, well, you're 32 years old and it hasn't stopped yet. So I think it's a forever thing.
Yeah. Someone just asked, how old are you guys? I think we're both 33.
Yeah.
We're in our 30s.
33.
So, yeah.
My birthday is next, so I'll be the old lady for a minute. But
okay. There's a handful of questions about baby development. So let's see. What did I see? I saw. Sorry. Someone had a 15-month-old that they were talking about Oh, here it is. Sorta Rhea, how long should I wait until offering food after nursing my 15-month-old? He constantly wants to nurse, but I know he needs to be eating more. Good rule of thumb. So in terms of introducing solids, we did a video all about that. And it normally starts between 4 to 6 months is when most babies who are born term are ready. And then a good thing is to offer the solids first.
Yes.
And then by the time they're 9 months of age, then they start to be getting a decent amount of solids. By the time they're 12 months of age, it's usually good to have them getting somewhere between 16 to 24 ounces, really at most, of milk in a day.
Right.
And so like your baby nursing is great. That's
It's
wonderful.
so wonderful.
Even someone asked about like, what's the best time to like, how long should you breastfeed for 12 months or 2 years? The AAP recently changed its recommendations to breastfeed up till 2 years.
I mean, as long as you want,
yeah.
like, is fine.
We did through 12 months. He was getting breast milk. But
it's so much work.
There's so much work. But definitely in terms of like normal development and getting your 15-month-old solid foods, I would offer them the solids first. They of course are spoiled by mom who is able to breastfeed
better.
them.
Yeah, definitely.
So, and then a couple other development questions I saw. Megan B says, when should I be concerned if my baby isn't rolling or interested in crawling? She's 5 months old and doesn't really care to try rolling. Tummy time isn't her favorite. And then I saw another one. Where was the other one about? Someone smiling, had an 8-week-old who doesn't smile yet. So both of these, the thing I will say about developmental milestones, and we should probably do a developmental milestones video.
Yeah.
Everything is a spectrum, from the time to crawling to walking to when do they smile to when do they lift their heads, like is very disparate from child to child, and can like say normal time to smile is 2 to 4 months or sometime in that. And so like you're definitely like in a fine window. Normal time to crawl.
Smile, is that late? Social smile sooner?
Yes, you're right. Yeah, sorry. But like crawling, so for us, like our little girl,
I guess 2 months is 8 weeks.
Yeah,
Sorry,
yeah.
I'm like, no, it's 8 weeks. That's 2 months. Never mind.
Crawling, even our own experience with our little girl, like she did not want to move. She didn't roll. She like didn't.
She wanted you to move her.
Yes. Yeah, she was very adamant. I am unhappy here. Please move me, peasant.
Yes, she wanted to be moved.
And so like she like didn't roll much. Like we have like no like noise making or light making toys except for like the ones that we try to get her to wiggle towards or roll towards. And like little things you can do from mobility standpoint is like get them halfway and just show them what their body does, and then realize that there's a wide spectrum of normal, and eventually they just get it. If you feel like,
but sometimes they don't, and you want to be closely working with your pediatrician.
Exactly, which is like at your well child checks is a great time to say, hey, here's the things my baby's doing. They're holding their head up, but they aren't sitting up yet without support. Is this normal? And asking those questions based on your baby in that way. And really, that's the big part of the pediatrician's job at those well checks is how is development going? Are they growing well? Are they doing their developmental milestones? And that's what they have that little questionnaire before your visit for too, is really to catch that. And the questionnaire, I always remember thinking like, oh, like she's doing so great. And I'd fill out the questionnaire. I'm like, oh, no, she's very average, which is fine. So if your child isn't doing all the things on the questionnaire at their well child check, that's normal. It's meant to kind of separate between the spectrums of normal. So it sounds like you guys all have pretty normally developing babies from these little things you've listed, and just know that there's a wide spectrum.
Yes, and the CDC I know has a new milestone.
Yeah, they recently changed the guidelines actually in the setting of COVID, realizing that they relaxed a couple of things, and so I think a lot of that is both good and bad to help parents realize that hey, there's a spectrum of normal, but also encouraging us all as parents to keep working on things like exposing them to good exposures as well. And so
Colleen Radica says, when does miscarriage rate drop significantly? So we have a miscarriage episode. Check out it goes into stats kind of week by week. Generally speaking, we know that early losses are very, very common. 1 in 4 people will experience a miscarriage. Once you do an ultrasound and we see, so this is usually around 7 or 8 weeks or so, and we see a fetus, a little fetal pole with a heartbeat around that 7 or 8 week mark, your chances of miscarriage go down to about 5%. So at that ultrasound around 8-10 weeks, when we see a little flicker of a heartbeat with a little fetus in that uterus, we say, hey, you can kind of take a breath. Chances are low. Once you hit second trimester, chances of miscarriage are less than 1%. I did see a question. Someone asked said they were later in pregnancy and really, really nervous about stillbirth. This is something that we have an episode recorded that we're going to release here in the next couple weeks.
Yeah.
We have kind of 2 episodes about stillbirth. The risk of stillbirth in the United States is extremely, extremely low, 0.6% or 6 in 1,000 births. And so it's so rare. It's of course devastating and awful, but very rare. So we'll talk, a little bit about kick counts and some other prevention things in that episode, but know that worry is normal. There's so many things to worry about. Know that the chances of stillbirth are super, super rare.
Yep. And then we'll have some content coming out later this month.
Yeah.
Charlotte May says, also, do you find you've improved at your job since becoming parents? I would say,
I always say that it has made me a different doctor, not a better doctor, because I think it does not serve other people well. Like, I don't think to be a good cardiologist, you have to have had a heart attack, or to be an excellent neurologist, you need to have had a stroke. I just think that
I think the biggest change it has for me is just understanding what I'm asking people to do. So in terms of like, hey, I'm going to prescribe a medication that I can choose to either make 4 times a day or 3 times a day.
Like that matters.
Choosing the 3 times a day, or even like the where that it take, like always being on as a parent, because a doctor, we have 15-minute interactions with families, or maybe 30-minute interactions with families. And so like just knowing that being a parent is way more work than I think I ever anticipated. And so I would agree, like it's still different. Like you do not need to be a parent to be an excellent doctor to a child, but it like helps you understand and empathize. I think
you really just get it at a different level when you're like, breastfeeding's really hard, or even if you're prescribing a medication where your doctor's like, oh, you should pump and dump and you're breastfeeding. It's like, do you have any concept of what that even means to like a breastfeeding or pumping mom? That's horrifying. I remember when I was taking letrozole when we were trying to conceive, and in the little midst of our secondary infertility battle, I took letrozole or Femara, and that is a medication that gets into the breast milk. They say you should pump and dump for 10 days after taking it. And there are really, truly very few medications that you should pump and dump for. And it's a passion of mine that patients are sometimes counseled incorrectly about what medications are safe during breastfeeding, a little alcohol during breastfeeding, different things like that people say this is bad, you shouldn't do it, whatever. So letrozole really is one of the ones that, like, I called the LactMed Center in Texas and said, is this real? What do the studies say? And in fact, it was. So for 10 days after taking that, so for 5 days you take the medication, then for 10 days later, you had to pump and dump. And pumping sucks to begin with and is a ton of work. And then to literally just be throwing that milk away.
And then on the other end, the stash of frozen milk in the freezer is going down. So there's definitely a lot of stressors with that.
Yeah. So you realize things feel differently when you've like lived it. I think they just feel a little different. So I would say we're different.
Yeah. Let's see. Other questions. A couple of people asked about food. So NV says, which food to avoid during breastfeeding and pregnancy? I would say in terms of the pregnancy part, if you actually go back to our third video ever is all I'm pregnant now. What we talked a lot about foods to avoid and things that are good, things that are bad.
Yeah.
Definitely those are kind of like the strict guidelines. There's a little bit of wiggle room on some of those, but like there are certain things that have potential risks while pregnant.
Yes. And we're doing this like OBGYN debunks 10 myth videos either this week, or myth episode either this week or next, and it goes into some of the food stuff a little bit. So Emily Oster, someone also asked us about this in the question thing. What do you think of Emily Oster's book? She wrote like Crib Sheet and Expecting Better, and she goes through a lot of the data on some of these recommendations about sleep training, alcohol, all these different things, listeria risk, and foods to eat. And it is just very interesting to have the data presented succinctly in a book. She's like an economics professor very clearly brilliant woman. So just if you want to kind of hear the flip side of the coin, it is an interesting couple of books to check out. Someone
also asked about foods when getting pregnant and they're getting gummy prenatals. I think the big thing is like, if you're like, I think it was an IVF question. Preparing for IVF cycle, what types of food would help me? Also, what gummy prenatals are okay, from Heather Page. Big things in terms of food, any like special foods?
So they try to study this, and studying diet and fertility is hard because there are many confounders. The general recommendation is that what I tell patients is we're thinking whole, as many fruits and vegetables as you can. Okay. Whole foods, lean proteins, limit processed food. So if you are taking it out of a crinkle wrapper to eat it, maybe this is something
your tongue may be happy about it, but
let's limit that. You want to limit the amount of pop or soda that you're drinking. You want no energy drinks, be drinking lots of water. A cup of coffee a day is fine. A glass of wine once a week is fine. We know that smoking is really bad for egg quality. We know that marijuana is bad for sperm quality. Other recreational drugs are not a good idea. And so you just overall want to try to be healthy and well. Getting your 120 minutes of exercise a week, but there is not good data that any one particular diet is helpful. In terms of gummy prenatals, the things you're looking for in your multivitamin are that they're at least 400 micrograms of folic acid. And that's really the biggest thing you're looking for. Gummies often I don't think any gummies have iron in them. Not a really important thing when you're trying to conceive. That's often something we see in pregnancy. Women need some iron and have to switch to a different prenatal vitamin. But
okay, a couple questions about vaccines. Ever Ready Paving says, my baby goes for shots next week. Should I space them out or get them all done at once? Because I've heard chances of fevers when doing a lot of shots together. And then also right after that, what is your chance of unvaccinating children from NV? So big thing, we actually just this last week put out an episode all about the COVID vaccine in children. And I think this is different than the rest of the vaccines. I encourage you, we spent a ton of time prepping for that video and a lot of the nuance about the data and benefits and risks of that. For our other standard vaccines, we can say that we've given Cecilia all of her vaccines on schedule as possible. There's pretty good data looking at spacing vaccines out versus not. The immune response is the same giving them all at once as opposed to spreading them out. The biggest risk of spreading out the vaccines is just that much more time that your child isn't protected from some of those vaccines. So for instance, the H influenza B vaccine is relatively new in the past couple of decades that has radically changed the risks of children with getting certain infections that can be life-threatening from that. And that's one of those things that hey, how serious is this? Well, it's definitely one that I don't want to push back. And so there's some of that. If you're really concerned about spacing vaccines, your pediatrician has been asked that question before, but there's no real good reason to space them out from what kind of immunity does your child develop from those vaccines if you space them out versus give them together, or even the fevers. There are some vaccines that definitely can have fevers that first night or 2 nights after. There's even about a 5% risk of rash with those two. Again, fairly mild, well-tolerated things to really help prevent and eliminate some pretty serious child diseases.
That being said, vaccine injury is a real thing. Risks are small that it happens, but it does happen. These are real concerns that you can talk with your pediatrician about. Most pediatricians, board certified pediatricians, agree with AAP recommendation that the benefits of vaccine outweigh these possible risks. But understand this
by quite a margin.
But yes. But it is okay to be worried about this and want to talk to your pediatrician about it. It is okay. That's why they're there. They will be able to walk you through that. Okay. Let's see. There's so many great questions.
We said we were gonna go for 30 minutes.
I know. Cease is still asleep though, so we can run with it.
Okay.
Someone asked about breastfeeding. Kind of what are the effects of breastfeeding when trying to conceive or being pregnant?
Yeah.
The biggest thing with breastfeeding.
Right here.
Nice.
Nadia Vecino.
What are the effects of breastfeeding when trying to conceive or getting pregnant? So generally speaking, it's just highly variable. If you get pregnant while you are, if you are able to get pregnant while you're breastfeeding, normally it's fine. Many moms continue breastfeeding while pregnant. There is discussion of like, especially in the first trimester, your nipples are extremely sensitive. It can be challenging in that respect. But it is possible. There are many stories about tandem nursing your newborn and your toddler. And so it is possible. That being said, breastfeeding often kind of messes with your cycle in terms of ovulation. If you are exclusively breastfeeding your baby every 4 hours, direct breastfeeding, lactational amenorrhea is what it's called, where it prevents ovulation and you don't have a period. And it can be very effective at suppressing ovulation for up to 6 months if your baby isn't going really more than 4 hours without breastfeeding. Once baby starts going longer stretches and they aren't, if they're sleeping overnight and they're going longer stretches between feeding, you may start ovulating again. Sometimes what we see with women who are breastfeeding and when their cycles return, they have what we kind of call a short luteal phase. Their cycles are just a little different. And sometimes the breastfeeding can have an effect on being able to get pregnant. So it just depends on you. Many women get pregnant while breastfeeding. It is why we say, hey, we need to have you on contraception after that baby is born, because it is possible.
Which goes to Tiff and Fam says, hi doctors, any advice about finding out I'm pregnant 3 months postpartum? So definitely
it is possible even if you are breastfeeding. But sometimes the breastfeeding can make it more difficult to conceive.
Yeah,
for sure.
Let's see. Victoria Connor says, hi, my question, can you paint your walls and floors while you're pregnant? Quick, kind of funny question. You may notice the stark contrast between the white wall in the corner and the yellow here. We just moved into this place that we're renting 3-4 months ago, and like, hey, we need a place to shoot our YouTube.
Right.
We got wallpaper that is like stick-on cheap white wallpaper.
Peels off.
That was really awesome. If you are in a place that painting is a pain, and it actually looks pretty nice.
Yes.
Except for when we're showing you more of the room.
Yes.
Painting and pregnancy.
So women are really more sensitive to smells, and paint has a lot of fumes. We don't want you in a room just intoxicated by paint fumes. You could wear a mask. I found it was a perfectly acceptable reason to say, hey, Kurt, why don't you go paint?
I painted in the last place we were for our place where we shot our YouTube videos.
Not because but it's the same kind of thought. Like, people are very concerned about getting their hair dyed in pregnancy. Like, can I dye my hair? Yep, you go for it. It's totally fine. Your scalp is not going to absorb, unless you have some have some issue with your scalp integrity. Dye your hair. It's totally fine. Don't be in make sure if you are painting, make sure you are in a well ventilated room, because I don't want you to pass out. Anyway.
Not particularly. So the follow-up question was, so it's not harmful. Limitedly so. Right.
Right.
Okay. I saw 2 schools. Did you guys have any issues with biting while breastfeeding? I definitely didn't have any issues with that, but someone else asked about biting too. Do you want to answer?
Thankfully, no. It was something I was very terrified of when she got her first teeth, and she popped her bottom 2 teeth at 6 months to the day. And you've heard stories about biting. Suggestions made by other women I know are to, if baby bites, you push their head right to the boob to make them stop. You yell like in a very big way, which you may anyway if your little tiger shark decides to clamp down on your nip, and it often scares them and they don't do it again. Those kind of were like the 2 big things. Ultimately, if they continue to have it be biting, you stop, you take them away, and they will learn this kind of cause and effect.
Mm-hmm.
I bite, I don't get the boob anymore is the takeaway from that. I will hope to not have personal experience with that, but if I do, I will keep you posted on what works.
Elena Wang says, when to stop swaddling? How would you recommend a transit from swaddling? My baby is 3.5 months old, but won't sleep without swaddles. Swaddles bad for baby development. So, the AAP official recommendation is not to swaddle, to use the baby swaddles. They are not approved for safe sleep.
I thought it was just weighted.
Weighted, yes. Yeah.
And then after
they roll. A certain age. So right. The big thing, and I can tell you we had a big transition period with this too.
She wouldn't sleep without
swaddling in a blanket is great for the first couple of weeks. Once your baby's able to start rolling, the risk of keeping them swaddled is that they could be in a place where they have their face into a place where they're going to suffocate. Is like the scary danger of having them swaddled. Once they're rolling.
Right. And then they can't roll back.
And so generally this 3.5 to 4 month age time is a perfect time to start transitioning. We tried doing one arm out for a while. She didn't like that. We tried the little starfish suit.
Yeah, I forget what that's called.
She didn't really
zippity zip. Zippity zip. We tried the Magic Merlin suit too. It's like a giant little. They look like the Michelin Man, and they're kind of just stuck because they can't. It's like a big giant snowsuit.
So some people find these work. They didn't really work for us. I feel like eventually we just transitioned to.
We were like, cool. We're going to sleep train you now.
Yeah. And that was our impetus for that. She sleeps in a little sleep sack that has her arms out, and the rest of her is zipped up into a little sleeping bag.
And I want to keep her in that as long as possible because I don't want her to climb out of her crib.
Congratulations to Annette. Hi, just had IVF and it was successful. Wondering how early I can do an ultrasound with prior ectopic pregnancy in the books and want that peace of mind going on 6 weeks this week.
Oh, congratulations. Yeah. So sorry for the heartache to get there. Excited for you now. So often if you have a history like this, we like to do an early ultrasound. So even around as early as 5 weeks, 5.5, we expect to see a gestational sac in the uterus and a yolk sac kind of shortly thereafter. Seeing the yolk sac in the uterus is inside that gestational sac is truly the number one things that tells us it is an intrauterine gestation, meaning it's not in a tube, it's not somewhere else. And so we often have an early ultrasound there, 5.5, 6 weeks, just to make sure it's in the uterus. Around the 6.5 week mark, often we might start to see a fetal pole and a flicker of a heartbeat. So soon is the answer. The other things that your clinic is going to be watching are there'll be trending your HCG, that pregnancy hormone numbers, because there are expected rises that we know to see with normally developing pregnancies. And so if those numbers don't make the rise along the way, it's another red flag for us to want to see you sooner to make sure, again, that pregnancy is in the right spot.
Okay. 3 more minutes. Is that okay?
Yeah. Because she's going to wake up and then we'll be toast.
Okay. A couple of quick questions. Where was I at? My wife had an emergency C-section and we've been planning to have another kid in a couple of years. Should we just go straight for C-section? We are planning an episode on VBACs. We've had lots of questions about vaginal birth after C-section. So please keep your eyes open for that. Yes. Hopefully in the next 2 months.
Yes.
It's on our schedule.
The kind of short answer is it depends on you and your goals and the reason for why you had a C-section. If you said to me, hey, we had a baby, our first was a C-section, I think I want to have 8 kids, I would say, let's try really hard for that VBAC, because after you have the risk of repeat C-sections it's major abdominal surgery. Anytime we do surgery, there is scar tissue, and 5th, 6th repeat C-sections get more dangerous in terms of risk for bowel injury, bladder injury, the risk of the placenta attaching incorrectly and having an accreta, which is a placental disorder that is very dangerous. And so it depends on what your goals are in terms of how hard you want to really push for that VBAC. We know that moms who have a vaginal delivery generally have an easier recovery and shorter postpartum stay. That being said, moms who are trying for a VBAC fail and end up with a C-section kind of get the worst of both worlds there. a scheduled repeat C-section is such a nice thing because you're like, oh, they're going to deliver me at 39 weeks and 0 days. I know what to expect, so on and so forth. There are different calculators that exist out there that your OB can plug in for you to say, here's how tall you are, here is why you had your first C-section, so on and so forth, and can give you an idea of what your chances are of a vaginal birth working, happening that second time around. So many variables. Definitely need to base it on you, your family, your goals, and your history. But it is possible. I love VBAC. We'll talk more about it soon.
Okay, BK says, did you use the hatch? Yes, loved it. White noise machine. It's great. You can set schedules and times.
Yeah, but like it's a white noise machine.
Yeah.
Like it's not cheap. There's nothing special about it. You know what I mean?
But we liked it and we used it.
White noise is totally fine.
Let's see. There's another one that I wanted to get to quick. Someone asked, baby is sick right now, having nasal discharge, no fever yet. If she gets a fever, can you give her Tylenol before going to the doctor? The general answer to that is yes, Tylenol is safe for all ages. I would talk to your pediatrician about specific weight-based dosing. You can check the box, but the challenge is the box says under 2 years to talk to your doctor. And so there's just some specific doses by weight. You can give it to treat the fever. The fever itself is not dangerous, so you don't need to treat a fever with Tylenol. If it's affecting them being able to eat and drink, and they're not staying well hydrated or they're breathing really fast, things like that. Also just good reasons to touch base with your pediatrician. But
sorry, you have a little sicko.
Yes. We've
fun.
had one many times this fall already. Okay. Okay. You got a last question?
Do you have a last question? Let me scroll. What nail polishes are safe to use on a 1-year-old toenail?
Oh, I don't know. We put
hopefully whatever OPI her dad's been peeing on her nails.
Yeah, Saturday morning is nail painting time with dad, so it's a mess, but we have lots of fun. Someone asked about coffee while breastfeeding and then medications you can do while breastfeeding. I was just looking up. The thing that we always looked at is the LactMed app.
LactMed app.
Yeah.
Yes. It's not that one though. The one that came to you. I think it might be $9 now.
LACTMED is like a really nice by the National Institutes for Health about all the medications that we use as professionals to look at like what is the risk in breastfeeding.
Yep.
And then caffeine in breastfeeding.
I'm not a coffee drinker.
Yeah.
So I think the biggest thing, I will find you a real concrete answer for this. The biggest thing that we think about is like caffeine and supply. I tell you, I know a lot of breastfeeding physicians who guzzle coffee.
Yeah. 2 cups, whether you're pregnant or breastfeeding a day, is safe. I think
we recommend less than 200 milligrams of caffeine when you are pregnant. I just saw this. There is a study that, and this is one of the myths. I will answer this specific question in our myth video. A study just came out in, I think, JAMA Network Reviews or something that showed maybe even smaller amounts of caffeine than we thought may lead to shorter offspring. We need to look at the study more. Okay. It just came up when I Googled this to kind of have some more background around it. So
our baby, I guess, is very tall, but didn't get any coffee from you. So I was going to say our baby's really tall and I drank a ton of coffee, but
great.
That didn't matter.
Great. That's your something. Okay. Next pregnancy, I want to be the dad.
Yeah.
It sounds like it's like a much better time. Okay. Hold on. I'm looking.
And then while you're looking that up, a couple questions. We've gotten a lot of questions the last 2 weeks about RSV. And then someone else just asked for an episode about ear infections. Mm-hmm. There's so many viruses going around. RSV can definitely be scary. I've treated many kids who are sick in the intensive care unit with RSV, but also many, many children don't. The biggest thing, regardless of the viral illness or the illness that your child has, is are they drinking well and have multiple wet diapers a day? It should be at least every 8 hours, hopefully much more than that. And are they breathing comfortably? So if they're breathing 50, 60 times a minute nonstop for more than an hour, if it looks like you see the muscles pulling in between the ribs, under the ribs, their little nose is flaring, things like that, and it is persistent for a half hour, call your pediatrician. Definitely things that happens with young babies, especially in the first 6 to 12 months, is that they that snot can also kind of the same stuff gets in their lungs and their airways aren't developed to the point that they can't pop off to other air vessels as well. And so that's the challenge with RSV and some of these other viral illnesses. So things to look for is difficult breathing, really fast breathing that is persistent. Sometimes you can just have fast breathing with a fever. So if the fever comes down and they're still breathing fast or they're working, please call your pediatrician.
Let's circle back to the coffee thing really quickly.
Okay.
From a journal article. It says fussiness, jitteriness, and poor sleep patterns have been reported in the infants of mothers with very high caffeine intakes, equivalent to about 10 or more cups of coffee daily. Studies in mothers taking 5 cups of coffee daily found no stimulation in breastfed infants 3 weeks of age and older. So a maternal intake limit of 300 to 500 milligrams daily might be a safe level for most other mothers. However, preterm and younger newborn infants metabolize caffeine very slowly and may have serum levels of caffeine similar to their mother's levels. So the CDC recommends 300 milligrams or less for breastfeeding mothers.
What is that? 3 cups, 4 cups?
You're the coffee drinker? I think there are
about 120.
200 milligrams in a 12-ounce cup of coffee, which is like 2 6-ounces. So
how big is your cup of
right?
coffee?
How big is your cup of coffee?
But generally 2 cups a day is.
Yeah, it's like we can talk all about alcohol and breastfeeding, but I was not a coffee drinker. But CDC recommendation 300 milligrams or less. Studies show 300 to 500 may be very safe levels in terms of not causing jitteriness or fussiness in your baby.
And same for soda, whatever the caffeine content of that. The nice thing about soda or pop is it tells you how much caffeine is in each can. So
now we have to go because our little child is going to wake up soon. Hope this was a fun way to do our Sunday Q&As. We hope to do more of this soon.
There's a lot of questions we didn't get to. So sorry we couldn't answer them all. We'll try to get to them.
And check out our upcoming content episodes on Wednesdays. We are so glad you guys are here on this journey with us.
Happy Sunday.
See you later.
Bye.